Ever. Thank you. So as people are trickling in, I'll just do some introductions. So my name is Maria Hasso. I am the Public Policy and Communications Specialist at Alliance. And I am very pleased to introduce our presenter this afternoon, Michelle Craig. Michelle is the Complex and Supportive Services Section Manager in the Office of Community Living at the Department of Healthcare Policy and Financing. One of the major projects she has been engaged in for the last 4 years has been to work with stakeholders to improve services and access to services related to the Children's Habilitation Residential Program, CHRP, waiver. Michelle started her career working as a direct care provider in a group home serving adults with intellectual and developmental disabilities in 1995. And since that time, Michelle has worked in various capacities at program-approved service agencies and came to the state in 2013 as the DD waiver coordinator. Michelle is also an integral part of our Emergency Response and Communities Committee, which is an Alliance committee that includes both Alliance members and external stakeholders. And when Michelle reported in one of the meetings that many of the CHRP services were approved to get targeted rate increases this year, she knew provider capacity also needed to increase, which is why we're so glad that we have such a great turnout to hear this presentation. So thank you all for being here to learn more from Michelle, and I will let her take it from here.
All right, thank you, Maria. And thank you everybody for joining this afternoon. Very excited to have this conversation with you. As Maria said, I'm the Complex and Supportive Services Section Manager at Healthcare Policy and Financing. I do have a couple of colleagues on the call as well, who will be here if there's additional questions. Nancy Harris, who some of you may know was a longtime CHRP waiver administrator and now is HCBS benefits. Oh, Nancy, I'm going to get your title wrong.
Specialist.
Thank you. I'm like, oh, manager. So Nancy's on. And then Karen Stewart, who is Karen, I might get this wrong too, HCBS benefits unit supervisor.
Yeah, that's right. Thank you.
Thank you. Okay. Well, I'm going to go over the agenda for today so y'all have an idea of what we are going to cover. Once we get into each section and go through each slide, what I'll do is I'll go through the information on the slide and definitely then pause for questions if people want to unmute and ask their questions, or we'll check the chat box as well to monitor for that. Maria, thank you for sending out the PowerPoint slides in advance, so hopefully everybody has those. For anybody who doesn't, we certainly will send those out after. I've embedded a lot of helpful links into the slide, particularly like the rate schedule and things like that. So if you have those handy and you're able to click on that, that would be great. The other attachment was we pulled out of the waiver some very specific provider qualifications for a couple of services that we'll talk about. And I think it's helpful for people to be able to see those, and navigating the waiver document can be a little difficult. So we'll go over that attachment as well. So for today, the key points that we'll hit, we're going to talk about eligibility for the CHRP waiver. Again, that's the Children's Habilitation Residential Program waiver. We're going to talk about the targeted criteria, like who is eligible for this waiver. Part of that definition includes that a child has extraordinary needs. So we're going to talk about what that means, the financial eligibility, and then the assessment that's used to determine the support need level for residential services in this waiver. Then we're going to go over the services and talk about the services that are available in the CHRP waiver, the reimbursement rates for those services. We'll talk about provider qualifications, what provider enrollment would look like for anybody who wants to become a CHRP provider. And then we have a couple of slides at the end that we find are helpful to talk about. One is transition to adult services, or even just transition out of the CHRP waiver. And then if there is county child welfare involvement, we have some pointers about things to consider and what's helpful in working with child welfare. All right, so we'll start with the targeted criteria. The eligibility for this waiver is children and youth, age birth through 20, and they must be determined to meet developmental delay or disability criteria. And as I think most folks on here know, that is done by the Community Center Board Case Management Agency. They have to meet the intermediate care facility for individuals with intellectual and developmental or intellectual disabilities, or ICF, IID. And then they have to have extraordinary needs that put them at risk of or in need of out-of-home placement. The next slide, we're going to talk about extraordinary needs. But before we do that, I want to point out that county custody or child welfare involvement is not required for eligibility for this waiver. Up until June 30th, 2019, it was a requirement of this waiver that the child had to be in the child welfare custody. We removed that requirement as of July 1st, 2019. So now the waiver can serve children who are not in child welfare and are eligible for these services, as well as children who are in child welfare and meet the eligibility for these services. To further dive into extraordinary needs, we did a lot of stakeholder engagement when we were revamping the targeted eligibility for this waiver back in 2018, series of stakeholder engagement. And so we really worked through this with stakeholders, and we wanted to have some criteria that was specific enough so that we really ensured that people who really were eligible for this waiver were able to access the waiver, but also to give a little bit more flexibility to case management operating in real time and helping families access the services that they need. That we do not require for this waiver an outside vendor to determine eligibility. Eligibility is determined by the Community Center Board Case Management Agency. So the first category is complex behavior supports. And so this is where a child would have to have, as diagnosed by a licensed physician, psychiatrist, or psychologist, some type of diagnosis or condition. That's a really poor way of saying that. I apologize. That results in them having extremely high behaviors that really create the. Now I'm stumbling over my words. I thought I was off to a good start. That really impair things like their ability to process things, emotionally process things, their judgment, and their capacity to control behavior. That documentation by the medical professional doesn't necessarily need to be anything fancy. We've said that it could be written on a prescription, the physician's letterhead, whatever it is, as long as it is signed by that medical professional. And then complex medical support needs are needs that occur as a result of a chronic medical condition. Again, it does have to be diagnosed by a licensed physician or what's the physician? They're not a physician, but you're oh my gosh, well, you're not quite a physician.
A PA.
Yes, thank you. Physician's assistant. It can also be a physician's assistant. And that if the condition has to have lasted or is expected to last at least 12 months, requires skilled care, and that without any intervention can really result in a severely life-altering condition. And again, that just needs to be on some form of documentation signed by that medical professional. Any question on those first two slides on targeted criteria? Jennifer, thank you. In the chat, how do these criteria differ from CES eligibility? I don't have the CES eligibility criteria pulled up in front of me. Maybe I can phone a friend if Nancy or Karen, you would pull that up. But there is a couple of substantial differences off the top of my head. One being the nighttime criteria, and then the how often the behavior intervention has to happen criteria. We don't have those in the CHRP waiver. We tried to make it, like I said, a little bit more broad, so it didn't have to be that specific about how often intervention is needed, how often the child sleeps. It's really that they just have these really complex behavior or medical support needs. And again, the other thing that's different is we don't require the third-party reviewer to determine eligibility. Did that help, Jennifer? Theoretically, Jennifer's second question, or building on that, theoretically, if eligible for CES, should be eligible for CHRP. I would say likely. I think that we are careful not to say without to say exactly that one person who's eligible for this waiver would be eligible for that waiver. That would really be up to the Community Center Board Case Management Agency to take a look to determine if they meet the eligibility criteria. But there are a lot of similarities that we do see. Children who are eligible for CHRP, or excuse me, eligible for CES, the Children's Extensive Supports Waiver, also become eligible for the CHRP waiver. And we do see some movement of participants between those two waivers based on their changing needs. Great, thank you. Okay, all right, well, we will move on to the next slide then. The financial eligibility. Much like the CES waiver, parents' income is not considered for Medicaid financial eligibility for this waiver. Social Security income is not required. However, if you move to the last bullet on the slide, if the child is receiving habilitation, which is the 24-hour residential service in CHRP, they will need to have Social Security income to pay for their room and board because Medicaid does not cover room and board. They will need the SSI disability determination or ARBOR application. So these requirements are very similar to CES. We'll just pause to note a comment in the chat from Natasha. Natasha says, we've seen some movement from CES to CHRP to access wraparound services specifically. Great, thank you for that. And we're excited to talk to you today about our wraparound services, and we will explain more about what those are in the upcoming slides, but that's great. Okay. Not seeing any questions on financial eligibility. Okay. All right, well, we will move on then to the assessment tool that's used in addition, of course, the 100.2 and all of those same processes that the case management agency does are the same for the CHRP waiver. But the tool that's used to determine the reimbursement level for residential services is different than the tool we use on the other waivers. So for the CHRP waiver, the assessment is called the Inventory for Agency and Client Planning, or ICAP. Much like the supports intensity scale or supports intensity scale assessment, or SIS, that we use on the adult waiver, the case management agency completes the ICAP assessment. Respondents can be those who have known the individual for at least 3 months and see them on a daily basis. And one thing that's sort of unique about the process we've set up for ICAP is that the ICAP assessment may be redone at any time without requesting permission from the department. We do recommend at least an annual review of the ICAP assessment to make sure that it still reflects the needs of the children. I mean, really, children change a lot from year to year, and especially going into teenage years. And so we want agencies to have the flexibility to be able to review and redo that assessment to make sure it's most accurately capturing the needs of the children and youth as those needs change. We do have the ability, case management agencies do have the ability to request a support need level review. I think most folks on here probably work in the adult side, and you know that we do have a process on the adult side to request a support level increase or a support level review. We built something similar for the ICAP. One thing that's sort of unique about the ICAP as compared to the SIS is the ICAP is a fairly old assessment, and or not maybe outdated. I don't know what the assessment, the exact year, but it's a little bit outdated in some areas, particularly maybe in some of the language it uses, some of the things it focuses on that if the child can do. One example would be, it can ask some things that if the child can do some activities that have since been replaced with technology. For example, and Nancy, you can pop something in the chat or pop off mute, but I think one of the examples is, can they look up something in a phone book? Well, I don't even know if phone books exist anymore. Most people are, you Google it, you do something like that. So we've spent some time, and by we, I really mean Nancy Harris and Michelle Lopez, looked at revamping our ICAP training to really help agencies have some ideas about how to navigate some of those questions that are a little bit outdated and apply them to life as we see it today. The other thing that's that's a little bit more difficult about this assessment is sometimes for the kids, the children and youth on the CHRP waiver, we see that they have some pretty independent ability with their activities of daily living, getting dressed, taking care of personal hygiene stuff, eating. Whether or not they choose to do some of those things in the way folks would ask them to do, that's another question. But they physically and mentally can do those things. But we see where so we see lower scores in those areas because where the real need for the child or youth is really in that behavior support. So sometimes because of that discrepancy, the assessment can come out with a low score for the youth, and really they need to be at a higher level because to reflect their needs and to accurately be able to, or to be able to reimburse agencies to really provide the supports that they need. So we do have the support need level review process, and in your slides, here's a link to I believe it's our operational memo on how to do that. That's done through the case management agency, but they would work very close with the service agency to gather the information and submit that. And Nancy Harris on our team heads that up, and we have a number of teammates who also support in that process. And we really do try to process those in a very timely fashion. We don't have set time for reviews. It's pretty much as they come in, we review. Because in particular, with children, things can be very volatile and change very quickly, and there can be a lot of emergencies. So we try to be really responsive to that, and Nancy is really superb at that. So I'll pause, and Nancy, I just want to give you a chance. Is there anything you wanted to jump in about the ICAP?
Okay, I was on mute. No, you covered it very well. I will go ahead and see if I can put a link in there for those that maybe were not able to listen to the presentation for the ICAP. They can, do that at a different time, but that might be helpful because it goes through it step by step.
Great, thank you. All right, we have a couple chats here. Check this, Ken. Hi, Ken. So Ken's comment in the chat is, my understanding is the ICAP is not very sensitive to capture complex behavioral needs. What additional assessments can be used? That's a great question. And Nancy, feel free to chime in. I don't know that we would speak to any additional assessments. We can only use the outcome of the ICAP because of the way the waiver is written to do the score. But we do have that exception, or the support need level review process, so that if the complex behavior needs aren't being adequately captured in the ICAP, then we ask that you submit that request to the case management agency, and we'll review that and take into account those things. And most often, I think we end up approving the higher level. I can imagine most of you are wondering, then why are we still using this tool? So I think probably most folks on the call are aware that the department, the Office of Community Living specifically, is really working towards implementing a new long-term services and support assessment tool. And so what the thought is we want to eventually stop using the ICAP and move to building an algorithm and the new assessment tool that would serve a 2-for-1 purpose. So it's sort of the 100.2, but it would also better capture the needs and then correlate to the support level rate. So that's where we're going. And because of all the dynamics involved in that, we felt, and after engaging some stakeholders, really felt like it was better to stay with the ICAP until we get to that new assessment tool, rather than try to get a new assessment tool and then a new assessment tool and then get to a new assessment tool, if that makes any sense. So we sort of have a workaround with this, and it's not great. We do still have to mail out paper assessments, but I think the end is in the future as we continue to make progress on the new assessment tool. Next question from Ken. For case management agency review, must this be done by the CCB or the RAE? It is done by the case management agency, but we encourage, like, the case management agency would do that with the support team, particularly the people who know the child best, who are working with the child on a daily basis. That could also include a member of their RAE team as well.
Thank you.
Yeah, thank you, Ken. And I think Nancy is going to post the recording of the ICAP training that was recently done. And Ken asked, will there be another training, Nancy? Do you want me to speak to that, Nancy, or do you, oh no, maybe there's a new message in here. Nancy, do you want to speak to if there's another training, or do you want me to? Well, she may be on mute. We'll post the training that was just done in August of 2022. We can post that in the chat, the recording. I don't think that we have plans to do another training immediately since we just did one in August, but we will continue to sort of monitor the process and get feedback from people throughout the year. And if we find the need to do another one, then we will we'll work to see if we can do that. Okay, sorry about that. I flipped ahead a slide early. So somehow when I like try to access the pull up the chat, then it's like accidentally flipped to the next slide. Any other questions on the ICAP? All right. Well, we will move into the services that are available in the CHRP waiver. One thing I'd like to say, just to kind of kick off, is that for children who are eligible for this waiver, they and their families can choose from any of these services. A child does not have to be accessing residential services in order to access the waiver. When we worked to make the changes we did in the CHRP waiver over the last couple of years, one of the big things we wanted to do is to make sure that children who are eligible for the waiver can get services that maybe help them when they really do need out-of-home support, but also provide some support for them to stay in the family home. So before I get into each of the individual services, I wanted to point out the links that are on this slide. So the first one is the CHRP rate sheet, and we will talk about rates here in a minute. I also put a link into the actual entire CHRP waiver document, a link to the CHRP rules, which live in the 8.500 section of the volume 8 HCPF rules. And then there's an operational memo that we released earlier this year that really talks about implementation of the home and community-based settings final rule within CHRP. The CHRP waiver and providers must be in compliance with the home and community-based settings final rule. As you probably are thinking, there are some nuances when you're working with children as opposed to adults, and there are some things that children don't necessarily maybe have the ability to do or access to where we say that adults do. So we spend some time getting feedback from stakeholders and then working also with the Colorado Department of Human Services, really talking through those things that were kind of tripping people up, and issued some guidance to help people navigate some of those nuances about applying the final settings rule to children's services. So I'll start with the services. Oh, Nancy keeps saying that she's getting kicked out. All right, so the updated ICAP training can be found on the HCPF website. Thanks, Nancy, and we'll work to either get a link out later, or we can send one out. Maybe Maria is sort of a follow-up if we have other things we need. Oh, Maria got it. Thank you. Okay, so we'll start with services. The first service is habilitation, which is it's really residential habilitation. So this is the 24-hour residential service. The service definition that's in the waiver and the rules, we work to align the service definition with the residential service definition in the developmental disabilities waiver. So it really is the same service. It's that 24-hour supervision and support service. And we'll talk about provider types here in a minute. But the service is really just to support that child 24 hours a day. This is outside of the family home. Habilitation is not provided in the family home. But much like the developmental disabilities waiver, the providers will just assist the children and youth with activities of daily living, getting out and doing fun things in the community, being a part of their community, getting ready for school or getting ready for activities, meals as needed, medications, going to doctor's appointments, follow up with behavior plans or therapy plans, that type of thing. And For this slide, I am just going to talk about the service, and then we'll talk about the provider qualifications in the next slides. The next service is Respite, and this is Respite equivalent to the respite service that's in the CES waiver. It can be provided in the home or the community, just like CES. You can have a respite provider come into the family home and stay with the child, or you could have the provider could take the child or youth out in the community. Also do have the ability to have respite in a more facility-based setting as well, and we'll talk about that in our provider qualifications. Community Connector, again, the Community Connector service is very similar to the CES service. However, the CHRP Community Connector service does have some additional requirements that the service is really geared towards supporting that child with maybe challenging behavior that they might experience and how to work on that challenging behavior while participating in the community. Oh goodness, like that keeps doing that when I try to remove the chat. Then the next two services, Wraparound Facilitator and Child and Youth Mentorship. These are new services that we added to the CHRP waiver in 2019. And if you look at the actual rules or the waiver, you'll see that these two services are actually subcomponents of two main service categories. So what you'll see is an intensive support service category and a transition support service category. Under each of those, the components of those services are Wraparound Facilitator and Child Youth Mentorship. I'll explain what these services are, and then I'll explain the service heading so it makes a little bit more sense. So a Wraparound Facilitator, this is a service that is sort of like a ray care coordinator, a case manager, and maybe another, like, I don't know, other type of coordinator all in one. So this facilitator really takes a look holistically, comprehensively at everything the child and youth needs and really works to support the family to get everything they need into place. They're not just limited to one specific thing that they can do or one small category of thing they can do. They can work with all of the other coordinators, the school district, educators, behavior providers, physicians, other medical personnel, to try to really make sure that services and supports are really all in line for that family and that youth to best meet their needs. One example that I like to use is things can be very different from environment to environment that a child could go to. I mean, maybe they have a certain behavior plan that's being implemented at home and with certain providers, but then at school, maybe it's looking a little bit different. So the Wraparound Facilitator could really help to say, hey, how can we maybe get these things more in alignment? Because some of those differences can really cause more difficulty for the child and family. And then the Child and Youth Mentorship Service, this is basically a direct support professional who would work with the child and youth on what they like to, just life skills. A lot of times, particularly with children with really high behavior needs, the focus becomes so much on controlling the behavior and sometimes getting a roof over their head if we're looking for residential supports. And I think what can get lost sometimes is helping them with just life things that they like to learn and do. So this could be Child Youth Mentorship could help the child. Maybe they want to join a club at school. This person could help them with skills or help them navigate how to do that. Maybe they would like to ask somebody to prom. This facilitator could work with them. Okay, so what are all the things we want to do? And maybe you want to shower more than once a week or whatever it might be. That just those things that people learn as they go through, that we could really help support these child and youth, particularly so to transfer in, or not, as they transition to adulthood, they have some of those skills and those experiences. So we've couched these two services under the header categories of it, intensive and transition supports. Intensive supports are when these two services are used to support the child or youth to remain in the family home. And then when they're used under transition supports, those are used to support the child to transition back to the family home after an out-of-home residential placement, or even from lower levels of care. Hopefully back to the family home, but it could be to lower levels of care. Then the last three services on here, I think most people are probably familiar with. We have massage therapy, movement therapy, and hippotherapy. And those services are basically the same services that are available in the CES waiver. Movement therapy does include music therapy and dance therapy. But again, these are just like the services in the CES waiver. And we'll talk about the provider qualifications for these in a minute. I'm going to pause and do two things. One, see if there's something in the chat. So Ken Wynn's question in the chat, are RBTs, which are registered behavior technicians, I believe I got that right, included as a support for intensive support or transition supports? Can the Child and Youth Mentorship be a registered behavioral technician? Absolutely, they could be a child youth mentor, or they could be a wraparound facilitator. If they want to be a wraparound facilitator, they'd of course have to get the wraparound facilitator certification to be able to be a provider for that. And then for the child youth mentor, and that's what's in the handout, and I can talk about that in a little bit more detail. They absolutely could be the mentor. They would just have to make sure their training curricula that you provide as an agency meets the topics of the 40 hours of training that we require in the waiver for that service. So if y'all look at your handout for that, we've listed out what the requirements are for a wraparound facilitator and what the requirements are for child youth mentorship. For wraparound facilitator, the person must become a certified wraparound facilitator. There are a number of wraparound training programs nationwide. So agencies can kind of take a look at what program they think would work best for them and use that. When you do apply to be a wraparound facilitator, we'll take a look to make sure that particular training we think would meet our criteria. So if you're toying around with it and you came across a wraparound program that you thought was great, you could always send that over to us even in advance, and we can take a look at it and see if this would be something we would consider to meet the requirement. One of the easiest things to do, and in the handout, there's a link to this. In the handout, there's a link to a website called COACT, and that's where it's with the Colorado Department of Human Services, and they provide high fidelity wraparound training. And the majority of the wraparound facilitators that we have for the CHRP waiver have completed this high fidelity wraparound training. The initial training is actually free. I believe it's 8 hours total worth of training broken up. And then there's also sort of a 2-hour introductory training. So individuals would take that training and complete that and get their training certificate. At the time the wraparound facilitator has completed the training, that's when the service agency could, if you're adding this as a new service, could add to your provider enrollment the wraparound service. And what we would do is we'd ask you to submit in your provider portal, upload the training documents that the person completed. We would take a look at it, and provided they met all the qualifications, and I just realized I may be getting a little ahead of myself with my slides, but I'll just keep going on this one. Once we approve you, we can approve your agency as a wraparound facilitator. At that point, your wraparound facilitator staff could actually start providing wraparound facilitation at that point, even before they're actually fully certified, because once they've completed the training, the next step is to work with a coach. So the wraparound facilitator can start marketing their services, getting clients, providing wraparound services sort of under the supervision or support of a coach. And that occurs for a period of time. Then once that's completed, then the wraparound facilitator gets their official certificate, and then they would upload that in the portal. But we have it set up that way because it's the wraparound facilitation coaching that does have a cost to it. So as long as agencies can bill for the that initial time period after they've completed the training and while they're getting their certification, that helps cover the cost of that coach. Ken clarified, what I'm asking is to be in the family home to support crisis. Yes, I mean, and I guess under Child Youth Mentorship, I don't know that would necessarily be a support person to be used in the home to support crisis. It would really have to be tied back to that service being delivered in a way that met the service definition. Okay. I want to pause there. Nancy, I don't know if you're still having any computer issues, but Nancy is the benefit manager for several of these services. And so I wanted to see if I give Nancy a chance to see, Nancy, if you have anything you wanted to add about the services.
I don't have anything to add, Michelle, but I think that it is really important to go back and probably read the definitions prior to, I guess, proposing that maybe a staff person can go in and assist. I'd make sure I read the definitions and the requirements prior to that, because they're pretty specific, but yet it doesn't mean that we don't look at the flexibility. So I think that's something, because they are fairly new. We're still looking at these and still kind of brainstorming different options, different opportunities that might be available that maybe we didn't think about. And certainly we have to go back to the way that the definitions were written in the waivers. So that's all I would add.
Excuse me. Thank you, Nancy. That's great. And I will say we've had some anecdotal information come back to us about wraparound services being very successful in supporting children to stay in the family home or with transition even. So these are services we're very excited about. We'll go through again a little bit more on provider enrollment, but if you all are interested, anybody's interested and just wants to have more of a conversation with us to dig a little bit deeper, you're thinking about this is something you might want to consider adding to your service array, we are happy to talk with you about any of these services. We're happy to meet with people one-on-one and really talk through what the services are, what it would mean, the qualifications. Really happy to do that. We're excited to grow our provider capacity for this waiver. We grow almost every month. We've had spurts where we grow a lot, but we're always looking to be able to expand services throughout the state to really get these services available to children and youth. A couple of things I want to point out about the services, and then we'll move into provider qualification. The respite service currently does have some very sort of strict unit limitations. We are changing that, which we're all very excited about. We are changing the respite unit limits for CHRP to actually be equivalent to the same unit limits in the CES waiver. So I don't have the unit limits off the top of my head, but it's 1,000 something units plus the ability to request additional respite units from the department. So we are working on that. We received legislative approval for that this last session. So we have a current waiver amendment with the Centers for Medicare and Medicaid Services to make that change, and then working on a rule change because it also has to be changed in rule. So we're working to get those done with the target date of implementation of January 2023. So that's very exciting.
Michelle?
Yeah, go ahead.
I might just add one more thing. I know in the past questions, and I don't know that you addressed this, but questions have come up about the difference between the responsibilities of a case manager at a case management agency versus the wraparound facilitator. And that's been questioned before. Okay.
Yeah, good point, Nancy. We didn't get into that. Yeah, we point out the wraparound facilitator is not a case manager. The case management agency is responsible for doing the assessment, for long-term services and support. I'm gonna get the whole 4 categories wrong, so anybody wants to help me out. Helping the family evaluate what home and community-based services they want, authorizing those services, writing the service plan, and then monitoring those services. The wraparound facilitator is going to be not just looking at their home and community-based services, but looking at all the service and support package all the way around the family, including natural supports, to help those all work really, really well together to support the family. Nancy, anything to add?
No, I just think that I know it's come up in the past multiple times, and I think sometimes case management agencies get confused about the role of the wraparound facilitator, but you're really working together, as a team, of course. And, so I just thought it might be important just to mention it.
Yeah, excellent. Thank you, Nancy. Any questions on the services themselves before we move into provider qualifications? Okay. All right, so we'll talk about residential habilitation. And so on this slide, I'm first going to go over our provider types, talk a little bit about the rates for these services. And then we have a special guest, Natasha with Parker Personal Care Homes. They've been a CHRP provider for many years, and Natasha's going to talk with us about some of the successes they've seen with serving children in the CHRP waiver. We just think that this waiver and these services can be so crucial to supporting families and trying to help families avoid crisis, helping to respond them when things are tough, getting them the services that they need, and really helping to set these youth up to transition into adulthood and lead the lives that they'd like to lead. So she'll give us some examples of some great things that they've seen happen. So provider qualifications for residential services. So I want to start by saying that for residential services for children and youth under the age of 18, by state statute, it is the Colorado Department of Human Services that has the licensing and oversight responsibility of that, regardless if the child is actually in county child welfare custody or not. So that's what's one of the unique things about this waiver as opposed to our other waiver, is that there are some services that fall under the rules for Colorado Department of Human Services because we align with them because they are the party that oversees these services. So the first type of provider would be a foster care home or a kinship home. So a foster care home, really, if you think about it, most of you are probably familiar with the idea of a foster care home, but it's sort of like the host home idea with a few more requirements. So then the kinship home is a provider type that could be where a family member is able to be provided for the residential services. And the kinship definition is even a little bit more broader to sort of include the family's natural support network in that. So under this provider line, the only providers who could actually provide this service would be a child placement agency or CPA. And that CPA does need to get a license under the Colorado Department of Human Services rules. And then they contract with the foster care home. They certify the foster care home and monitor the foster care home. Same thing with they would do that with a kinship home. The other option we have under this category is sort of a hybrid. And I feel like every time I talk about this, I want to credit Foothills Gateway and Larimer County Department of Human Services, who really brought this to us years ago. Because what we've heard and found is that, we've got our huge host home network and our huge program approved services agency network, right, who are serving the adult developmental disabilities waiver. That's a really good source of provider expertise to tap into to serve children and youth on the CHRP waiver. However, what we found is that the majority of PASAs, program approved service agencies, are not child placement agencies, and nor do they want to be, and that's fine. There are certain requirements and some different things for child placement agencies that maybe just don't fit with maybe directions that PASAs want to go or how they're set up, and we completely understand that. And then we also have host homes who don't want to become certified foster care homes for a number of reasons. I think Natasha is going to talk to us a little bit more about that too in her examples. But we want to figure out a way of how could we try to have some type of hybrid option. So what we ended up putting in the waiver is we will allow a PASA to be a residential provider for CHRP under foster care home or kinship home, only if the host home that they're using is certified by their local county of Department of Human Services as a foster care home. We've seen some really good success with this model. It's it could be sort of a one-off. It doesn't work in every situation. We don't have every county in Colorado doing this, but we are seeing more counties moving towards being open to the idea of doing this. I think we've seen it most often. I know Larimer County was pursuing it. I don't know if they have any currently, but Denver County, recently we've seen Wells County pursue this option. I just received an email today from Developmental Pathways, so out in that Aurora area, that they're working with their local county, and there's some movement there to the county being willing to partner with PASA. So I wanted to put that out there too, to say if any of you listening here are in that Developmental Pathways service area, and this sounds like something you're interested in exploring, please reach out to me. My contact information is on the slides at the end. We'll make sure, if it's in the chat or whatever we need to do, but please reach out to me. We're happy to have the conversations with you to answer questions more specifically and connect you. If you're in the Developmental Pathways area, connect you with that team doing that work, or even in other areas, if you're thinking, hey, I'd love to do this, but I don't know if my county would be on board. Again, reach out to us and we're happy to make those connections. I just been working with another PASA to help with their connection to Jefferson County to pursue this, possibly Adams. So we're happy to do that. I will say quickly that we do recognize that ultimately the easiest option, it seems, would be to be able to allow host home as a provider type for underage 18. We definitely would like to do that, and we are pursuing that with talks with Colorado Department of Human Services. We would have to develop that provider type in their rules and really take a close look to make sure we don't miss anything with allowing that provider type for kids under age 18. But we do have that on the to-do list and are looking at that. We recently raised or increased the rates for the foster care home service. Some of you, if you've ever looked at the rates before, they were pretty low, and really people were maybe more incentivized. Even if they were interested, they could serve someone on the developmental disabilities waiver and be able to be better reimbursed than the CHRP waiver. So thanks to a lot of stars aligning and the Colorado General Assembly approving the request, we were able to raise the foster care home rates effective July 1, 2022 to match the host home rates for the developmental disabilities waiver. So now those rates are on par, which we are really excited about. The one difference, though, for foster care home is we don't have an upper negotiated support level yet. We just have support levels 1 through 6, 1 being the lowest, 6 being the highest. We are looking internally about what it would take to add that negotiated level 7 rate. So that's sort of our next step that we're looking at. And I will note too, with that wage increase, even for CHRP, there does have to be that provider attestation about meeting the minimum wage. So it just aligns with the same reimbursement methodology for the developmental disabilities waiver. Our other provider type is host homes for CHRP participants age 18 to 20. So once the participant turns 18 and they want to remain in the CHRP waiver, maybe they're continuing to use Wraparound or mentorship and want to stay in that waiver, they could actually utilize a host home for that service under a PASA, because after age 18, we don't have that child CDHS oversight component. The third type of provider is a residential child care facility. And this is a facility that's licensed by the Colorado Department of Human Services. It's a really like a more congregate setting. We have various sizes of them. Some are smaller, resembling a small group home. Some are a little bit larger, up to maybe 12, 14, the ability to serve up to 12 or 14 children. And with the residential child care facility, this is really for children with a higher, pretty high behavior support needs, so that you have more staff. They provide additional services that are billed separately, like under the state plan, but they provide other services as well, like behavior services, things like that. Some of the facilities actually have facility-based schools attached to them. We're always looking to increase that provider type as well. I don't suspect there's anyone on today who maybe would be in the business of opening a licensed or residential childcare facility. But again, if you are, let us know. We're happy to talk through the nuances and the details of that. Excuse me. Our rates for residential childcare facility are very, very high, and that's the only provider that we're able to do an upper level negotiated rate for. And at this point, that's really because, again, these are the children with really complex needs who a foster care home at this moment is not working for. They need 24-hour staffing. A lot of times 2-to-1 staff, 3-to-1 staff, lots of extra supports. So we have that. And then the other provider type is a group facility or center. So this essentially has to be, the oversight is done by a child placement agency. And this could really be either what we know of as a traditional group home that's, maybe 4 to 6 people living in a home with rotating staff, or it can look something more like there's foster care parents who are actually the group home managers, and then they have additional staff who come in to support the home. Okay, I see some chats. So I am going to look through the chats and then we'll see if there's any questions. Okay, we've got the handout. Comment from Natasha in the chat. I am not the expert, but in my experience, a case manager would be ideally a part of the wraparound team for the family, since they are an integral part of supporting the family, which works with the wraparound plan. Great, thank you, Natasha. Sorry, I probably should have read that one before we move to the next slide, but that's a really good point. Teresa, can you repeat that one more time, please? I'm sorry, I lost you in the chat, Teresa. Can you mention what section, or if you want to come off mute and tell what needed to be repeated?
Yeah, it was when you started with, and now I'm not gonna, I just missed enough of it that I'm not able to pull it back around. Sometimes when I type, I miss it, but it was when you started the conversation regarding PASA and CPA, and you were talking about this unique thing that's come from Larimer and someone else, another agency, and you were talking about taking a child into a home as long as it's licensed, maybe. And I wasn't sure if you were talking about host home or what have you, but whatever occurred between Larimer and the other agency is where I got lost. Sorry.
Okay. Oh, no worries, Teresa. Okay, so essentially this is where we would allow a host home under a PASA to be a foster care home provider only if that host home was certified as a foster care home by their local county Department of Human Services.
Gotcha. That's exactly what I was talking about. Thank you so much.
Yep, no problem. Then Randy in the chat said, who can we talk to about this? And I would assume that's on that kind of hybrid. Randy, if you want to, I mean, please reach out to me directly, and we can talk more about this and kind of find out what county you're in and talk a little bit more about that and make those connections. Happy to do this. Comment from Ken. This is probably for a larger conversation, but the issue I have seen with CHRP, and I must say this is an amazing service, is that there aren't enough CHRP providers willing and able to work with clients with complex behavioral needs. When appropriate, I have done training on behavioral approaches consistent with trauma-informed care and proper life skills there should be more focus on CHRP providers getting proper behavior supports and training. Thank you very much, Ken, duly noted. We're actually looking at ways to do that, looking at some disability cultural competence training for behavioral health providers, as well as some potential trauma-informed care training statewide that we're looking through one of our ARPA projects. And I don't have the other folks on the phone today, but I'll use this to just make a plug that I saw that one of our large ARPA projects, that's the training fund project that people can apply for grant funds for training. That was posted, I believe, last week. So if you want to look on the department's ARPA grants page, if people are interested in pursuing some type of specific behavior training, trauma-informed care training, applying for one of those grants could be a great thing. So, but that is noted, and we're working on that, because I completely agree that I think if we can give people the supports and training and skills, they worked on that today, the supports and skills to work with these children and help be more proactive and really identify what's going on, will help prevent behaviors and will help thereby help find providers a little bit more easy. And then Randy, again, talking about I think the hybrid with the PASA and the county. Can we do this in El Paso County? Absolutely. And Ken says that apparently you are. I will say,
yeah, I'm in El Paso County. Thank you.
Okay. Thank you, Randy. I did talk with El Paso County specifically because they had some turnover, some new leadership. I think some people retired. I met with them maybe about a month ago or so, because they were really interested in this. And so I think that they will be pursuing that. So if you want to connect with them directly, Randy, you can email me and I'm happy to make that connection.
Perfect, because we have about 5 homes, 5 host homes that used to be foster home. They're approved foster home. And they were asking about that, and I couldn't answer the question because I'd never heard of this hybrid program before. But that would definitely cover it then.
Okay.
Awesome. Thank you.
Yeah, awesome. Thank you. And a question in the chat from Judy. Hi, Judy. Have these services been impacted by the workforce crisis, or is there so much interest that there are plenty of providers and staff to provide the service? Oh, Judy, you made me smile. I wish there was so much interest that we had plenty of providers. No, there's definitely been an impact here. We've seen it. It's difficult to get the foster care home. Providers willing to do that anyway, just like we're seeing across recruiting host home providers and everyone else. And then you sort of tack on the additional requirements for the foster care home, and it makes it sort of duly harder. So it is very difficult. I think probably Teresa and Natasha could speak to that. It's been just as difficult there. And I think in some of the staffed settings, that's had an impact as well. It's hard, been hard for people to get the direct care workforce in there. Okay, well, I am going to pause and give you all a break from listening to me for a second. Make sure we don't run out of time too. I will turn it over to Natasha with Parker Personal Care Homes. If you're ready, Natasha, for your provider spotlight.
Yeah, thank you. Thank you for having me. And I know what I'm talking about, but I feel like this is pretty broad. So I'm going to try and stay on track here. I wanted to start with going back to not specifically a couple of questions, but something Michelle mentioned and just some questions kind of touched on is the CES, the CHRP movement. And where we have seen that a lot is, and I typed it in the chat, but accessing wraparound, which isn't exactly what I'm here to talk about, but I just wanted to mention exactly what Michelle had said about working to keep children in the home. We've seen that in 2 different scenarios where they were on the CES waiver, transferred to the CHRP waiver specifically to take advantage of those in-home services like wraparound in an attempt to keep the child from being placed out of the home. And one of those was a middle school age child. And it was, I wouldn't say the biggest success, but she did stay in the home. So there was some progress. It wasn't rainbows and roses, but there was some progress and she did stay in the home and they're doing better now. Whereas my other one, same situation, and it did ultimately not lead to, but there was an out of home placement. But regardless, the skills that were gained by the family, the awareness of just how to support. This was an older teen. The wraparound goal, his wraparound goal was to move to California. And the team was like, what? Like, we can't support this goal, but it's an individual led, as it should be, person-centered goal planning. And if his goal is to move to California, great, let's go with that. What needs to happen for you to go to California? Because guess what? All of the team's goals were somewhere buried in there. So really highlighting this individual's goal of wanting to move, very typical teenager in a lot of ways, wanting to move to California to be a DJ or something like that, right? But now we have to do all of these other things. We have to finish high school. We have to get a driver's license. There was a lot of success there as well. And that resulted in CES to CHRP accessing those wraparound services. The other place that we've seen a lot of success is in individuals who have never had services before. And this goes for both the not accessing residential parts of it, just the services. So Community Connector is the biggest one that we use as an agency, and just being able to get families on board. And and Michelle can tell me if I'm wrong here, but one of the small silver linings to COVID is that still, I believe, we are able to have family members work as staff for Community Connector and for some different roles. So not only is an individual able to access services on the CHRP waiver when they've never had services before, but now we're helping a family just bring in a few extra dollars maybe, and we're getting that direct pipeline to adult services, because that's one thing, being on the CHRP waiver, there's no longer a 15, 16 year wait list or whatever it is these days. There is that guaranteed spot. And I apologize, I don't work in the adult world. I might not be using the correct lingo, but I assume I'm close enough for your understanding. So being able to come in, I had a mom in tears just a few weeks ago saying, we've never had services. He doesn't want to do anything. He's turning 18 in a few months. What do we do? And we were able to talk about some different supports that she has when we get to adult, but in the meantime, and those all come from accessing that CHRP waiver. Our biggest success, and one that I really wanted to talk about, was a very unique situation. None of these are child welfare cases that I've mentioned. Michelle said, we've been CHRP providers at Parker for as long as I have been there and longer. I've been there 10 years. But prior to a couple of years ago, really, it all happened right around COVID. So that's my mark, is February 2020, January 2020, right in there. All of our CHRP was child welfare placement. So the way that we our elevator statement about CHRP is youth who did have high needs. What we typically saw most of under the CHRP waiver was high medical needs, is what we saw a lot of. So when that CHRP waiver changed right before COVID, one thing that really opened up was these families who don't have child welfare cases. And one of our biggest successes is a youth who, it feels weird to call him a youth now. He was 14 and now he's almost 17, but he had been placed, again, not child welfare, so this is private, had been placed out of state because he just wasn't doing well in the home and school, but it wasn't a child welfare situation necessarily. Could parents have accessed it as far as a beyond control parent? Sure, probably. But that's just not the way their path went. So this youth had been out of the state for a couple of years at this point, attending basically a residential school setting. I'm not exactly sure on the specifics, and I don't want to make it any better or worse than it was, but he was a middle schooler out of state because parents didn't know what else to do. CHRP waiver opened up. They were able to bring him back here and place him into one of our licensed foster homes. And again, this is through the CCB, no child welfare involvement whatsoever. And that was our very first CHRP placement. We did not do wraparound with this individual, but regardless, he was able to access all of these different services. He has some physical limitations, so he was able to access massage and some of the music that I know there's some familiarity with. So he was able to come back to the state, be in the same general area as his family, siblings, parents, go to church with them on Sundays, but still have that out of home placement. And still, we just did his SP renewal a few weeks ago. And when they check in with parents on how things are going, we still hear, we didn't know something like this existed. We can't believe that we were able to access these services and supports and have our kid back here in the metro area. And not only, so he's in a foster home, a licensed foster home, of course. We're a PASA as well. So they're also a host home. So he's about to turn 17. And of course, he will always have the choice, just like every individual. If he wants to look elsewhere, move, of course, that will be his option and his choice. He's very happy where he is right now. And the beauty of, and this can happen in other places as well, but definitely in church, the beauty is he doesn't have to move if he doesn't want to, because he's also in a host home. And as much as we have struggled with getting host homes to become a licensed foster home, because when you look at the onboarding process between the two, they're vastly different, right? I think very different. But on the flip side, foster homes becoming host homes in a CPA PASA model is a switch that, not a switch, an addition that people are really willing to make and can really allow for at least the option of, you know, we want these long-term, we want these connections, these long-term stays when necessary. And I mean, this is really kind of the ultimate dream as far as, which I know it's pretty picture perfect and not many cases go this way, but everyone is so happy and supported, and it just works well for the household, for the biological family. And it just allows for that seamless transition into adult services, and staying in the same home if he wants, which is pretty cool. So I think, oh, and just to touch on the last question, or one of the last questions about services being impacted, 1000%. While we've been serving CHRP, when things changed, as far as the CCB piece, we kind of created a whole CHRP department, Children's Intensive Services. And we had a good 3 months, and then COVID hit, and it's wraparound services and those pieces, getting the child youth mentor. Those are hard pieces, not only to fill staff wise, but then you have the qualifications. And Michelle and I talked a little bit about the horse before the buggy, right? How do you get clients and then hire someone? So that is one of the struggles, but I feel like that's not universal, but just a to be expected struggle, just to get that ball rolling. But the successes, the flexibility, if you will, of having CHRP clients through child welfare as a CPA or through that CCB or CMA avenue is really a unique component. So, Michelle, is there anything else you want me to speak to? I'm a talker. I'll just keep going. So I'm trying to stay on point here.
No, I think that was great. Does anyone have any questions for Natasha?
Oh, gosh.
All right, well, maybe just the last thing, if you wouldn't mind touching on, because I think, and I was this way before I had the honor of being able to do this project. I didn't know anything about foster care, right? You hear rumors and you hear things. And I think sometimes when we hear about a foster care home and the requirements of that, it feels a little scary and a little time intensive.
Sure.
Would you mind speaking briefly to sort of what your experience is? And every agency is going to be a little bit different, but maybe where there might be more similarities than we think between the host home process and foster care home certification?
Yeah. To be transparent, similarities are somewhat limited, just because things are very different in a lot of ways. So our host home providers, and again, I'm just talking our agency, but our host home providers are background checked and the background checks that are done for the adult side, but they're completely different background checks done for the CPA side. We have our own license number, CPA's a license number separate from our PASA. So background checks, quite honestly, the home study, I think, is the biggest difference. And I don't know the familiarity level of home studies, but basically a home study practitioner is what they call them, will go out to a home once a week. It has to be at least a week apart, but once a week for at least a minimum of 3 visits. I say 4 is the more typical, but that really varies with experience and comfort level and complexity of families. So, and then we're writing a big home study report about how these people were raised, how they were parented, how they parent now, kind of worldviews, if you will. That's a little generic, but I mean, we go into details about the neighborhood, what's nearby, what's the school district. So that's the biggest difference. One of the other outcomes to COVID is that all of the foster care trainings are done online now. And as an agency, for the most part, we use the CWTS website, Child Welfare Training System. I don't know what the S is for, but it's CWTS, where they have what used to be called CORE, if anyone's heard CORE, or there was another acronym, PATH. I literally taught it. CORE or PATH is what they used to be called. Now there is a foster parent fundamentals on the CWTS site. That's the only, it is online, but it's a live Zoom. Friday afternoon, all day Saturday training. The rest is self-paced and all online. So they can come and go, do it at their own time, except for that, we still call it CORE, for that foster parent fundamentals. So I think training wise, and I know this differs agency to agency, but I know there's onboarding trainings for a host home. So there's some similarities there. Foster parents are doing 27 hours of initial training to become a foster parent. And that's pretty much covered for them, as I should say, outlined for them on what trainings to take, how to acquire those hours. So I think the training is similar. The home study part, completely different. Home inspection, about the same. If you're a host home in good standing, your home inspection is probably pretty spot on, with some differences based off of age level, right? If you have a toddler, we're childproofing a home, whereas you might not need to childproof a home for a teenager, or you might need to childproof a home for a teenager. So there's obviously some variability there, but we use almost identical home inspection form as our adult side. So that piece is an easy crossover. Training hours a year is a big difference. For a CHRP home, it's 32 hours of training a year for a CHRP foster home. So I don't know what the hourly or annual requirement is for a host home or what that looks like. But I do, from my knowledge, I don't recall it being 32 hours, or even there being an hour mark, as much as specific trainings that need to be done annually. So I think those are the biggest pieces. Become a foster home, everyone in the home has a physical, every adult in the home gets fingerprinted. That includes adult clients, which surprises some people. But regardless of, we've had individuals who require 24/7 medical care that we've had to write letters to say this person, can't get fingerprinted for X, Y, and Z reason, but just because that is the expectation for every adult in the home. I
still have not heard back from the doctor or therapist when you.
So I think, I think that very loosely and not greatly outlines differences and similarities between the two.
Thank you. I think that's helpful.
Okay.
And it still is complicated, but I don't think it's not unsurmountable. And I think we find sometimes when people get into it, if this is something they really want to do, it's something that I think a lot of agencies really work with people on.
For sure. And I by no means do I want it to be a negative or a deterrent by any means, but just as a provider to know what to expect as people hear the training hours or they hear the home study and they're like, oh, really? But just what we do is just encourage them that, we're there to and I always try to say this in not a demeaning way, but we're there to hold their hand positively. Like, we will guide them, we will support them and make sure they have, the links they need to register or the information they need to get their fingerprints done. And we try to make it as simple as possible to ease that initial reaction that you sometimes get mentioning training hours and or the home study process. It can be a little intrusive. But another thing we do is just encourage families to keep in mind that we are trying to accept you as a foster family, not reject you. So questions, inquiries, that kind of thing, or so that we can support you becoming a foster care provider. We aren't asking these questions to try and X you out of the process.
That's really great. I appreciate it. Thank you so much, Natasha. Does anybody have any questions for Natasha?
Judy said about capacity, having a hard time, even with adult host home providers, there tends to be so much movement that it's scary. Yeah, it is tough. And I think Michelle mentioned earlier that the capacity definitely does come up. And then with the host home model, even an increase in CHRP capacity, I've already heard some things of, Michelle, you might have been the one that said this, but increase of CHRP capacity, but we still have that overarching, no more than 3 individuals in a home can be receiving disability. And I always mess up I know it's not Medicaid, but disability or Social Security. I'm sorry, I always mix up what it is, but I know there's the 3 rule.
Yeah, it's essentially a combination of 3 people, either adults receiving services on the waivers or children receiving services on the waivers.
Right.
We are increasing just the children's capacity. CDHS updated their rules and we will be doing ours. But for foster care home, right now it's a limit of 3, sort of any combination of kids on CHRP and kids not on CHRP. We're changing it to a limit of 4.
Yeah.
With that sort of any capacity of kids, children not involved in CHRP and children involved in CHRP. We're hoping that will help. It's hard because we look at it and these are kids with really high needs. If you go back to the targeted eligibility criteria, so we would question how safe it would be to have much more than that, because these are our children with really high needs. But hopefully this will be a nice middle ground to help with that.
Well, and that's the other part is, yes, they have high needs, but as a licensed foster home, you have 2 adults and a CHRP individual. So you have your 3 waiver. I mean, hypothetically, a licensed foster home could take a youth who isn't on a waiver, who's in foster care for a reason that maybe isn't as related to medical needs, behaviors, and those pieces, and is more of a home environment, or, and I don't say this lightly, there's just not a better word for it, but a more typical going to school Monday through Friday, right? They don't have 3 therapies a week or these extra services necessarily in place, or there's not a nice way, a more typical placement or more typical youth that doesn't have those high needs.
Yeah, exactly. All right. Well, thank you again, Natasha. We really appreciate it.
Absolutely.
All right. Okay, so we are down to 10 minutes, which I think we'll kind of run through. These other ones are a little bit easier than that bigger conversation. And I apologize. I got ahead of myself here. Real quick, want to check the chat. We got Judy's comments. Yes, thank you, Judy. Elise said she'd love to provide wraparound services, but have a hard time finding staff. I hear you. I think we all hear you on this call. I know everybody's working to try to build capacity. Obviously, HICPUP is continuing to look at what needs to be done. Keep hoping that we will get back there. I think there's got to be an end in sight till we start to be able to attract more workforce. And then Ken says in the chat, the capacity issue that I have seen is that there are not many willing providers to take clients with complex behavior needs. Yep, that continues to be the case. But maybe we get some trainings out there and keep working on rates and stuff. We can get back there. Okay, so we'll run through the provider qualifications for the other services because they're pretty easy. For Respite, I think most folks on here are probably PASAs. There might be some people who are not, but if you're a PASA approved to provide respite in the CES waiver, you meet the qualifications to provide services in the CHRP waiver. And so you could add CHRP to your enrollment. We'll review that. I'll talk about that process in a minute. Foster care home in a residential setting could also be provided in a foster care home, residential child care facility, group center, or host home age 18 to 20. And the requirements for the provider would be the same as the previous slide for those residential services. Provider qualifications, community connector, and the professional therapies. Again, hopefully this is super easy. That if the provider is approved to provide any of these 4 services in the CHRP waiver, or excuse me, in the CES waiver, you meet the qualifications for the CE or for the CHRP waiver. So again, you would just add the CHRP specialty to your provider enrollment, and we would process this. Go forth, next slide. So the provider qualifications for wraparound and child and youth mentorship. Again, there is that handout that goes a little bit more deep into the trainings that are required for those two service subcategories. For your actual provider enrollment, what I have listed here is the types of providers that we would that could qualify. So here, you don't have to be a CES provider because we don't have quite an equivalent service in the CES waiver. So really where I think most of you would fall who are on the call was what we call a Medicaid enrolled provider. So if you were interested in adding CHRP, either wraparound or child youth mentorship or both, I'll show you the slide in a second, but you would add you'd add CHRP to your provider enrollment, you'd complete an additional application. It's not necessarily a new application, but you'd sort of be adding it to your service array. And then we'll be in contact with you to get the documentation we need that verifies the trainings for the services before. And then once that's all good, we can approve you with the training. Child placement agency could also provide wraparound services. We have the county could, I don't know that they would, but we have, well, actually, because we do have Boulder County actually is a wraparound provider for CHRP. And then RCCF could also have a wraparound staff, but they would all have to meet those same provider requirements. Okay, Ken says, just put this out there, I would be more than happy to provide training. Awesome, thank you, Ken. So people can get in touch with Ken if they're interested in that. I have your email, I know where to find you. Jennifer, what is the limit of consecutive days of respite before a service is considered habilitation? That's a great question. I think we've probably been posed that before. We don't have anything that specifically says that. I would say you need to look at point back to the service definition. Respite is for the primary relief, or for the relief of the primary caregiver. So if that's what the service is being used for, then you could use respite up to you meet the unit limits of respite. Habilitation is not used for the relief of the primary caregiver. This would be the caregiver is not able to care ongoing for that child or youth in their home, and they need to find another home that provides that real 24-hour habilitation that comes with all those extra support requirements that maybe aren't necessarily included in respite. Does that answer that, Jennifer? Okay, wonderful. All right. Oops. Okay, real quick, I want to say, and I'll come back to the chat. The CHRP waiver does not permit the case management agency to also be the provider agency. This has been long-standing. I won't go into the details here, but you may notice, particularly in some areas where we don't have a lot of providers outside of the community center board, we're a little stuck at this point because the waiver just doesn't allow for that. We're continuing to look at that, but we're hopeful as the system moves towards case management redesign that they'll open up some more options here that we could get more rural providers. But essentially, this waiver had never been in conflict because previous case management was at the counties, and CMS, Centers for Medicare and Medicaid, said you can't take a waiver that's not in conflict and put it in conflict. So this has been sort of a continual workaround that that we have faced, as well as I know many of you on the call. Provider enrollment. I want to make a note. I mean, I'm hoping that several of you are getting a little excited and thinking about, would you be interested, or you might be interested in this. So we can definitely support you with provider enrollment. Chelsea Morehouse on our larger OCL team helps us a ton with processing these, making it easier, explaining stuff. We're really able to help in whatever way we can. One thing though, if you are considering enrolling or adding CHRP to your enrollment, I would encourage you to wait until after November 1st. I know that seems odd, but here's why. I want to save you extra work. So where we're at is CHRP, for some reason, when we did all of our systems change, we never got specialties added for the individual services. For our other waivers, you apply, is it the waiver provider type, you apply for DD, and then you have numbers for each of the services that you are applying for. CHRP, we don't have that yet. We just have one provider specialty, and that's 619 for all services. So we have to do a lot of manual workaround on the back end to verify the services that people are applying for. So we are adding those specialties after 3 years, may actually be 4, which is super exciting. We'll have communication going out about that, but what that means is that folks will have to redo their enrollment within a time period. It won't be right away, but within a year. But since we're so close to November 1st, I would just say, if you are interested in this, which I certainly hope you are, wait till after November 1st, just to save yourself some hassle. So here are the instructions of what to do if you are a Medicaid provider, if you're not a Medicaid provider, and if you're a waiver provider. So here's the information. Please reach out to me directly. I'm happy to talk through these. And Chelsea emailed me before the call and said she unfortunately wasn't able to join us, but she was like, hey, send people to me, happy to help out. So we really want to make this as simple a process as possible. Okay, so I want to get to the chat in a second, and we're almost running over time, so people have to jump off. I understand. Maria, I probably have like 3-4 minutes. Might go over a few. Hopefully that's okay. People jump off. That's fine. I wanted to talk about, or wanted to go back to the chat from Terry. I'm a foster parent in a very small community with a very high needs child. We struggle to find resources, and the county is wanting me to become CHRP certified. Okay, well, Terry, if you want to talk more about that, or I'm happy, you can reach out to me. My email's on the webinar, and I can also put it in the chat. So yeah, we can talk more about what that would look like. All right. So the next thing I wanted to just go over really quick is transition. Transition to adult services. So with CHRP, we do extend the eligibility through the age of 20. And what we hope with that is that the youth can really then choose to transition to either the adult waiver or whatever services they want, or move to California, as in Natasha's example. But that gives them some breathing room to do this. And it's not like at age 18, we have to transition to something different. So we encourage people to support the people you're working with to really do what's in their best interest. If you're working with the county, or the county does happen to be involved, they do typically tend to drop off at age 18 with the way that system works, and that's fine, but that doesn't mean they need to leave the CHRP waiver. The other thing is that the developmental disabilities waiver does have reserved capacity for CHRP participants. So for those who want to move on to the DD waiver, there is no cliff there, so that they can still, again, transition anytime between 18 and 20. Doesn't jeopardize that reserved capacity. Okay. And then the last slide is just when there is county child welfare environment. Again, sometimes there is, sometimes they're not. We're starting to see numbers trend towards fewer CHRP participants being involved with the county than we've seen in the past, which is super exciting. I think all of our goal is to really get that minimized, unless there really is and it sounds terrible because I don't sound like I'm wishing for that, but that there really is something that would necessitate child welfare. And it's not just needing services that's causing the issue. So we're hoping to get there. We'll also tell you all really quick, I should have said this at the beginning. As of July 2022, we have 220 active PARs for the CHRP waiver. So that's really exciting. I know it sounds small compared to some of our other waivers, but maybe smaller numbers, but these are huge needs, right? I'm not to say big kids, but have a huge need for this, and a lot of times really dire situations. So those numbers really mean a lot to all of us, and those of you who I know are working currently in the CHRP realm. When we started this work, there were so few enrolled participants that we couldn't say it in public meetings because of our protected harbor. But we know there's a lot more children out there, and we hope with the ongoing partnership of great agencies like you all, we can just continue to expand the ability to serve these children in a variety of ways across the state. Okay, so involvement with county child welfare, if they are, just make sure that you are partnering with the county and all team decisions. We find that it works best when everybody's working together, everybody's kind of on the same page. You know, the provider agency goes out and does the monitoring at the same time as the county caseworker. That tends to work really well, as long as that works for the family. It's not too many people in the house, you know, all those individual details, but definitely helps lessen the burden on the family and keeps everybody hearing and seeing the same things. Decision making can be a little bit of a question when the county caseworkers involved. There could be multiple levels of decision making or who can make decisions. So we just say make sure you consult with your county caseworker to determine who is the person who can make the decision for the child for different things, medications, things like that. And then any suspected or alleged abuse must be reported to Child Protective Services. All right, then again, these links were all throughout the slide. I just put them in sort of an easy reference spot for you. And then I'm going to put just in case, my email in the chat. And does anybody have any last questions? I apologize for going over. Okay, I don't see anything. Maria or Kylie, anything else we want to say to wrap up? I'll just say I really appreciate your time today. And I appreciate Maria and Kylie and the Alliance for helping pull this together and helping host this. This is really great. And please contact me for any next steps. We're happy to get you in the right direction. And we also have other folks like Nancy and Carrie. We have a whole team of people here to support.
Yeah, we wanted to just thank you so much, Michelle, and as well as Natasha and your team with Karen and Nancy, just for being here. And that was a lot of information. We will be sending out the recording of this to everyone that registered, as well as Alliance members will have access to it as well. So we can't thank you enough for spending some time with us. And we only went 4 minutes over, so not too bad.
That's great. Well, thanks, everyone.
Thank you. This was really good.
Thank you.
Thank you.
I hope everybody has a great rest of the week.
You too. Bye-bye.
Bye-bye.